personalized metabolic care, less burden, improved adherence, and ongoing innovation. Thank you very much for your patient hearing. And I will not be doing justice to my talk if I do not pay my gratitude to my guru, my teacher, my mentor, without whom this full talk would not have come out. The best teachers are those who inspire us to be our best selves. Thank you, sir, for being a constant source of my inspiration. Thank you to all.
Thank you for finishing in time, and we have open forum now. Any questions?
Thank you, madam. Thank you for your extensive presentation. Just one practical question regarding the presently available anti-obesity drugs. After achieving weight loss, whether the patients are able to sustain the weight loss, or what will happen if we reduce the dose or stop the drug? What is going to happen?
Sir, what is going to happen is different. Patient, actually, it depends on the patient. He learns to eat less, and he'll actually adopt to that lifestyle modification. If he adopts, actually, when we stop the drug, we see about a 10% of weight gain is there. But more than that, it's a habit, behavioral therapy, he has to follow it, sir.
Okay.
Thank you very much for the organizer and as well as for all the delegates. It's an excellent program has been organized by Dr. Bala Murugan and Dr. Rajendran. And these three topics are really wonderful, especially all the topics, and I think they need more time for the presentation or expressing their view. And I just have a doubt with my friend Vengo regarding the intergenerational. It is a wide spectrumic topic, very upcoming topic regarding the, he explained about the memory which is being transmitted from one generation to the offspring, even if the person is not exposed to that environment. That is a point of the core theme of the topic. And whether it can be, it is more of an epigenetic pathway. And any suggestion or maybe any data from the national health, I think it has been done extensively in UK. Any suggestion about the arrest the progress, or maybe any precautions or any medical therapeutical approach in breaking the barrier?
Exactly, sir. That is where the research is now targeted and focused. One simple thing is demethylation of the methylated DNA. Sooner or later we are going to be speaking on those molecules, but because they are not even in the phase 2 trials, we cannot speak on those, but definitely this is the future.
Yeah, thank you very much. It's a very extensive topic. And next one is the bariatric surgery regarding our therapy, especially in the weight reduction, has been extensively from the beginning till the end has been told very clearly about the role of bariatric surgery and the outcome, not only for the reduction of body mass as well as the metabolic outcome. And any new points which is being upgraded in the recent time regarding the bariatric surgery, any suggestion from anyone from the surgical side or gastroenterology beyond general medicine?
Thank you, sir. Yes. Thank you for the opportunity, sir.
Thank you for the chairpersons for the thematic symposium.